Hi, Deborah. Nice to meet you.
Hi, Mr. Mitchell. Nice to meet you. How are you?
Good. How are you?
I'm fine, thank you.
Tell me about yourself. What do you see as your strengths, and why?
Well, I have been an LPN now going on 7 years, and I've worked first and foremost right out of LPN school in a doctor's office, which was incorporated into a family practice. In that time, I was able to work with infants, toddlers, adolescents, elderly, OBGYN, and in the end, I was offered the triage phone nurse position, in which when patients called in, then I was in charge of figuring out who was the most sick or who needed to see this or if it was an emergency. From there, now I'll be recently graduating and sitting for the boards here soon for my RN. And I've been here at Chestnut Ridge for the last year, and my unit that I've been working on the most is the DRTC.
How would your most recent nursing instructor describe your performance in the clinical setting?
I think my most recent instructor would say that I'm very competent, very confident, and very compassionate and care deeply for the patients.
Great. Tell me about your most challenging clinical assignment and what you learned from it.
My most challenging assignment would be here at Chestnut Ridge. It wasn't a clinical setting for school, but it was on the job, and it was the first time I had to call a code for safety reasons for a patient. And in doing that, I had to make sure, since I was the one that called the code, I was in charge of the full code, which lasted 3 hours. And I had to, first and foremost, make sure the patient was safe first. And on top of that, I had to make sure everybody around me was safe. Furthermore, after that, I had to make sure all the documentation was correct and that everybody around me who was involved documented as well, and that their documentation was correct. And then after that, I had to not only debrief the patient and the patient surrounding the situation, but I also had to debrief the staff as well, which it really did end up very successful.
All right. What skills do you feel you've gained from your past work experience that may help you in this position?
Well, just in saying what I answered the last question in regards to calling the code, I also have been oriented to each unit here at Chestnut Ridge and have worked various shifts and have gotten to know many of the patients and have gotten to know a lot of the conditions and the diagnosis and have learned to understand a lot of the pretty complicated ones and how to therapeutically deal with them, and also have learned the medications that they all are on and the side effects and things like that to look for, since a lot of the patients here have the same diagnosis as most of the time.
What are your future career plans?
My future career plans right now are to be working here at the DRTC and continuing to grow here with my career and continuing my education from an associate's degree to a master's degree.
Where do you expect to be in 2 or 3 years?
In 2 or 3 years, I sincerely would like to be in an educational type position, teaching, whether that would be research or teaching a class here in regards to, alcoholism or narcotics or things like that, to other nurses and the different medications involved, etc.
Now 5 years? Or,
5 years?
yes.
5 years I would hope to be pretty much stable in that teaching position and possibly move on, to further research and things like that.
We do not have any openings at the present time in the areas in which you have indicated at your interest. Would you be willing to accept a position in another?
I would. I would. Like I said before, I feel confident because I have oriented on each of the units, and I feel very comfortable with, each position that there is involving nursing care and being in charge.
Now tell me, are you a self-motivator?
I am. I pretty much have been that way for a long time. I keep busy pretty much a lot, and when I'm not busy, I find something else to do or ask somebody else if they need any help, and it's been that way for a long time. I've finished pretty much all my nursing online, which I think pretty much explains you have to be self-motivated to do that.
Great.
Yes.
What do you feel you've contributed to your patients?
I feel that I have offered great patient care and advocacy to the fullest extent that I can.
That's great.
Yes. Okay, thank you very much for the interview.
Thank you.
Okay. Bye.
Bye.
Nice meeting you.
Nice meeting you.